This patient has Tetralogy of Fallot requiring surgical repair. This video shows a surgical procedure. There will be cutting and sewing of live human tissues, and blood and other human bodily fluids may also be visible. Viewer discretion is advised. The right atrium is opened. The tip of the inferior caval cannula can be seen within the right atrial lumen. The inferior caval snare is loosened and the spout of the inferior caval cannula is turned around and inserted into the inferior vena cava. The inferior caval snare is then reapplied, and the cannula is secured to the snugger. The atriotomy is then fully extended downwards. Stay sutures are placed in the corners of the tricuspid valve. The patient has a perimembranous ventricular septal defect, and this is found just behind the septal leaflet of the tricuspid valve. This is the view through the right atriotomy. With a pair of forceps grasping the septal leaflet of the tricuspid valve, the perimembranous ventricular septal defect can be seen behind it. The free edge of the septal leaflet is detached. This exposes the ventricular septal defect and allows us to sew in the patch. Just below the forceps is the septal leaflet with its edge detached. The tips of the forceps are resting on the rim of the ventricular septal defect, and the pericardiotomy sucker has been passed through the defect with its tip resting in the lumen of the left ventricle. A ring towel is placed over the sternotomy. The first 5 sutures placed are the pericardioplegited sutures harvested earlier. The margins of the ventricular septal defect in this area are very close to the annulus of the tricuspid valve. In order to encompass sufficient tissue for a strong repair, these first 5 sutures are passed from the atrial side of the tricuspid valve to emerge through the margin of the ventricular septal defect on the ventricular side. The remaining sutures around the margin of the ventricular septal defect are placed entirely within the right ventricle. The Dacron patch for repairing the ventricular septal defect is measured against the defect and then cut to the correct size and shape. Then the sutures placed earlier around the rim of the defect are taken up in turn and passed around the margin of the patch. The patch is then parachuted down into place and the sutures are tied.